Okay, so today we're diving into a field that's always intrigued me, mental health social work.
Oh, yeah.
You've sparked our curiosity with this one, and we're going to unpack a bunch of insights from RoleCatcher,
Right.
which, for those who don't know, is a career platform using some really interesting AI. It's
Yeah.
like getting your cheat sheet to understanding this whole career from like the everyday stuff to the skills you need to really make it.
Yeah. It definitely goes beyond just like those surface level things you think about.
Right.
We'll uncover those like aha moments about mental health social work.
I love those aha moments. Those are the best. That's what these deep dives are all about.
Yeah.
So let's just start at the very beginning.
Okay.
What is a mental health social worker?
So RoleCatcher defines it as professionals who help people facing, mental, emotional, even substance abuse challenges.
Okay.
And the key is they give customized support.
Right.
It's not like one size fits all.
Yeah.
They're working with individuals, each on their own path.
That makes sense, but it can't just be like individual therapy sessions, right?
Right.
What else is part of that customized support?
It's actually a pretty wide range,
Mm.
Like, think direct therapy, yeah. But also, like, crisis intervention.
Right.
When someone's in a really, really bad spot. Then there's, like, the advocacy part of it.
Oh.
Being a voice for clients,
Mm-hmm.
navigating those systems, even educating the community on mental health.
Wow. Okay, that is way more than I initially pictured.
Yeah.
You're dealing with some intense stuff and being an advocate and educating.
Yeah.
That's got to be both incredibly rewarding, but also potentially pretty draining.
Yeah, you hit the nail on the head.
Right.
RoleCatcher talks about both the pros and cons.
Okay.
On the plus side, you're making a real difference.
Right.
Being there for someone when they need it most.
Right.
And you're always learning and growing from those experiences too.
Yeah, those are some strong motivators for sure.
Yeah.
But what about the flip side?
Right.
What are some of the tougher parts of this kind of work?
I mean, as you can imagine, there's a big emotional toll.
Right.
RoleCatcher specifically mentions like emotional stress,
Mm-hmm.
often from huge workloads, and sometimes just not having enough resources to help every single client.
Yeah.
And of course, hearing those really difficult, even traumatic stories, it impacts you.
Definitely.
It takes its toll.
Really highlights the need for self-care in this profession.
Right.
Right. You can't help others if you're not taking care of yourself.
Exactly. And that's like the whole reason we're doing this deep dive.
Right.
To give you the complete picture. The
Absolutely.
amazing rewards and the very real challenges.
It's all about informed exploration.
Yeah.
So we've talked about what they do, the good, the bad, but what about actually becoming a mental health social worker?
Okay.
How do you even get started in this field?
Like a lot of professions, education is key.
Right.
RoleCatcher talks about a few different educational paths, and it might surprise you what kinds of degrees are relevant.
Okay, I'm interested. I'm going to guess social work is a given, but what else is there?
Social work is definitely up there,
Yeah.
but also psychology, counseling, sociology, even human services or public health.
Wow, okay.
Those all play a role.
I'm starting to see how interconnected all of these fields are.
Right.
It's not just about understanding mental health like on its own, but how it's affected by social things, the economy, access to healthcare. It's all related.
Exactly. And when it comes to certifications, the LCSW, that's Licensed Clinical Social Worker.
Right.
It's a common goal.
Okay.
But there are also specific ones, like if you want to do substance abuse counseling or trauma therapy.
So yeah, lots to learn, lots of ways to specialize.
Yeah.
But RoleCatcher also gets into the core skills and knowledge you need beyond degrees, right?
Yeah.
And this is where it gets super interesting because they've actually ranked these skills by how important they are.
They have, and it might surprise you.
Like
Social perceptiveness is 80% importance.
80%. What does that even mean in this context?
It's more than just hearing their words.
Okay.
It's understanding those unspoken things, their emotions, what motivates them.
Right.
All while you're like navigating their experiences.
Wow.
You're reading between the lines, being a detective of human behavior,
Yeah.
which is so key in mental health work.
That makes a lot of sense. You're dealing with people in such vulnerable positions.
Exactly.
Being able to pick up on those cues is huge.
Yeah.
What about systems evaluation? That one seems a bit out of left field.
Not really when you think about it.
Yeah.
Mental health doesn't exist in isolation.
Right.
Right. Clients are dealing with like healthcare systems, social services, legal stuff, even just their own families.
Yeah, all these complex systems.
Exactly.
Okay.
A mental health social worker who's good at systems evaluation can spot those bottlenecks,
Right.
advocate for better resources, maybe even change policies to make those systems better for everyone.
So you're not just working with the person, you're working with the systems around them. That's powerful. So we've talked about the what and the how of this career path, but what about the where? Where do mental health social workers actually do all of this?
Oh, good question.
Paint me a picture.
Get ready to be surprised because the work environments can be incredibly diverse. We're talking like hospitals, clinics,
Right.
community health centers, even private practices.
Wow, okay.
Some are in schools,
Right.
some at government agencies.
Mm-hmm.
It really depends.
So you could be working with kids one day and then like advocating for policy change the next.
Yeah,
So
exactly.
that's a huge spectrum.
It is. And each setting has like its own resources, its own clients,
Right.
even its own like workplace culture,
Yeah, for sure.
RoleCatcher really highlights how much variety there is.
So it's about finding the right fit
Yeah,
for your personality and what you're passionate about.
exactly.
Speaking of, like, what does a typical day even look like?
Right.
Is there even such a thing as typical in this job?
That's the thing. There really isn't.
Right.
It's not your typical 9 to 5.
Right.
You might have therapy sessions planned, but then like a crisis could just pop up.
Oh, right.
You have client advocacy meetings, maybe case consultations with other professionals.
Yeah.
It's a dynamic workplace. You got to be flexible.
Okay, so if you like routine, maybe not the best fit.
Right, exactly.
You have to be on your toes,
Right.
ready for anything.
And speaking of adapting and growing, RoleCatcher actually outlines some interesting stages for mental health social workers
Okay.
about how your responsibilities change over time.
I love a good career progression story. Break it down. What are the stages?
Okay, so they often start as an entry-level mental health social worker.
Okay.
Think of it as like boot camp.
Right.
You're doing those first client assessments, helping with treatment plans, connecting clients with resources. It's very hands-on.
So lots of direct client interaction from the start.
Yeah, that's where you really use those social perceptiveness skills we talked about.
Okay, exactly.
Then as you get more experience, you might become an intermediate mental health social worker.
Right.
You're taking on more responsibility, making those treatment plans, maybe even supervising newer staff.
Oh, wow. So now you're the mentor.
Right.
That's got to be rewarding.
It is. And your expertise grows even more when you reach the advanced mental health social worker level.
Okay.
You're dealing with more complex cases, providing clinical supervision, maybe even like shaping how programs are run in your organization.
So not just working in the system, but on the system.
Exactly.
That's where the systems evaluation comes in.
Absolutely. You're thinking big picture, seeing what works, advocating for what needs to change.
I can see how this career path lets you grow so much.
Yeah.
Is there like an ultimate level, like the mental health social work guru?
There is. It's the senior mental health social worker.
Okay, tell me more.
This is where it gets really cool.
All right, I'm ready.
It's like you become a thought leader in the field.
Wow.
You might create brand new programs, consult on policy to improve mental health services, even do research and share what you learn.
So you're not just impacting individual lives anymore.
Right.
You're influencing how mental health care is given to so many people.
Exactly. It shows the impact a dedicated mental health social worker can have.
That's amazing. And speaking of impact, RoleCatcher also mentions something that's becoming more and more relevant.
Okay.
The role of technology,
Wow.
specifically AI.
Yeah, AI is huge right now.
It's everywhere we turn, but how does it fit into mental health?
Well, RoleCatcher talks about telehealth,
Right, telehealth,
which has become way more common.
especially since the pandemic.
Exactly.
That makes sense. It makes mental health services accessible to people who might not have them otherwise.
Right. It breaks down those barriers.
But what about AI, like more broadly?
Yeah.
How does RoleCatcher itself fit into this?
This is where it gets meta,
Okay.
RoleCatcher, because it's powered by AI. It's actually designed to help people looking for jobs, including future mental health workers,
Right.
navigate the job market, which is really competitive.
So AI isn't replacing people in this field.
No, not at all.
It's helping them.
It's supporting them.
I like that.
Think about applying for jobs.
Right. It's a lot.
It's a lot. You have to fix your resume, write cover letters, research employers, practice interview questions.
It's overwhelming.
RoleCatcher uses AI to make all of that easier.
So for someone who wants to do mental health social work,
Yeah.
RoleCatcher can help them find jobs,
Exactly.
make their application stand out, even like Practice for interviews with AI feedback.
Exactly. It takes out the guesswork.
It makes it less scary.
Right. It lets you focus on developing those human skills that we talked about.
Right, like empathy.
Yes. Empathy, social perceptiveness, being able to think critically.
Those are the things AI can't do.
Exactly. AI can't replace those.
It's like AI is taking care of the boring stuff so you can focus on what matters, connecting with people and making a difference. And you know what's cool?
What's that?
RoleCatcher isn't just for mental health social workers.
Right.
This stuff can help anyone, no matter what job you're looking for.
Totally. In this job market, having that extra help is huge.
It's all about working smarter, not harder.
Exactly. And you know what else RoleCatcher talks about?
What's that?
Something that's key for everyone, not just in mental health. Always keep learning.
Oh, for sure.
It's not enough to just learn stuff once and stop there.
Right.
You got to stay curious.
Which makes total sense in a field like mental health.
Totally.
New research is always coming out, new therapies.
All the time.
And the world keeps changing, which affects mental health in new ways.
Right. It's constantly evolving. So RoleCatcher is like, hey, mental health workers, stay updated. Go to workshops, go to conferences, read the latest studies.
So it's not just what you know when you start.
No.
It's about always learning new things.
Exactly. Being ready to adapt.
Sounds like this job is for people who really, truly want to help people.
Absolutely. And that brings up a good question for you listening.
Okay, I like where this is going.
Are you ready for a job that pushes you to always be learning?
Okay.
One that needs you to be empathetic, resilient, and really, truly want to make a difference.
Those are big questions, but they're so important to think about. And, hopefully this deep dive has given everyone a clearer picture of what it really means to be a mental health social worker.
Totally.
The good, the bad, all of it.
We just scratched the surface, though.
Right.
If you're curious, don't stop here. Go check out RoleCatcher's guides. Look at those interview questions they have. Really picture yourself in those real-world situations these amazing professionals deal with.
Your journey into this world is just starting. Who knows what you'll discover?